If you live in a state that has not expanded Medicaid and you don't make at least 100% of the federal poverty level, then you want to watch this video because I'm going to explain to you why it is that you do not qualify for the premium tax credit for the marketplace insurance subsidy, okay? And so stay tuned to the end to make sure you watch the entire video so you understand exactly why you don't qualify, but also something that you can do in order to get some health insurance coverage, okay? And so if you are new to me, to my channel, or to any of my content in social media land, my name is Katrice Daniels, and I am a licensed health and life insurance broker, and I help African Americans to navigate their health and life insurance options, and then we come up with an affordable but comprehensive plan based upon your budget, okay? And so I'm also the founder of Insure Black America. I don't know if you can see that there, which is my community initiative, and it is to close the coverage gap in insurance for African Americans in the United States, okay? All right, and so let's go ahead, let's jump into it, okay? People who don't make at least 100% of the federal poverty limit, they fall, and they live in a state that has not expanded their Medicaid program, then they fall in what's called the coverage gap, okay? Now, the coverage gap only exists in about 9 states, okay? Or 10 states, okay? And so, well, no. 10 states have not expanded their Medicaid, but there's a coverage gap in 9 of them, okay? Wisconsin partially expanded their Medicaid. So however they worked it out in Wisconsin, there is no coverage gap there. I'm not licensed in Wisconsin, but they are one of the states who they don't get the enhanced federal funding for the Medicaid expansion. So technically they haven't expanded it based on what the government's definition of expanded. However, there is no coverage gap in Wisconsin, okay? But the states where there are coverage gaps are Alabama, Florida, Georgia, Kansas, Mississippi, South Carolina, Tennessee, Texas, and Wyoming. Now, if you are in Georgia, coverage is available, but only if you are working and reporting that you are working, okay? So if you are not working, okay, then you don't qualify, okay? Now, if you live in the states of Florida, Georgia, Mississippi, Tennessee, or Texas, and you have some questions, you can book an insurance consultation with me. I am licensed in those states I mentioned, and so you can book an insurance consultation with me, and we can look into your specific situation and see what we can do to get you covered, okay? So now, if you don't know what FPL is, the federal poverty limit, or how to what it is, how to calculate it based on your household size, I will link the video. I did a video on the federal poverty limit, and so I will link that video in the description of this one, and I'll also put it up here on one of these sides, whichever side it shows up on, for you. You can click that video and you can go and you can see that, okay? So it'll be in both places, okay? Now, so basically what it is that when you don't make enough, you don't make the minimum federal poverty limit amount for your household size, and your state has not expanded Medicaid, then you don't qualify for any health insurance, okay? And so there's an estimated 1.9 million Americans currently in this coverage gap, okay? And so the reason that there is a coverage gap is because when the Affordable Care Act was written, it was written for the expansion of Medicaid to adults under age 65. with household incomes up to 138% of the federal poverty level. Okay. And so originally the law required states to expand their Medicaid to continue to receiving their regular federal Medicaid funding. But in 2012, the Supreme Court upheld everything else about the ACA but struck down the Medicaid expansion requirement, leaving that up to each state to decide whether or not to participate. Okay. And under the court's ruling, the states would no longer lose their regular federal Medicaid funding, even if they refuse to implement the Medicaid expansion. Okay, because Medicare is ran by the federal government. That's a federal government program, insurance program for those 65 and over. Okay. But for Medicaid is co-ruled with the states. And so the states kind of have a little bit more leeway when it comes to Medicaid, okay? They have nothing to do with Medicare, but Medicaid, that's kind of like they kind of run the show with the federal government, okay? And so the court said, hey, since the states kind of run each Medicaid program, then it should be up to them whether or not they want to expand their program or not. Okay. Now, because the premium subsidy is not available to people with incomes below the poverty level, if they're ineligible for Medicaid under their state's rules, then they have no coverage, okay? So they can't get Medicaid, and then they also can't get the subsidy to help pay for a marketplace plan, okay? And so there is no law, okay, that says that the states have to provide that coverage if you don't meet the guidelines. Okay, so you are essentially just stuck like Chuck. Okay, so here's a few possible solutions. Okay, if you are in the coverage gap. Okay. So one thing that you could do, the most obvious that you could do, is to increase your income to at least the federal poverty level. Now for 2024, the federal poverty level is $15,060. Okay, so you need to make at least, say, $15,100 for 2024 in order to be eligible for the tax credit. Okay, now if you fill out an application and you say you're going to make that amount, okay, and then you don't make that amount, when you file your taxes, okay, you're going to have to pay back because you weren't eligible for that. Okay, and so increase your income. That's the first thing you could do. Okay, another thing you could do is you could move to a state that has expanded Medicaid. Now I know that's easier said than done, but if you are able to move to a state that has expanded their Medicaid, you could do that, and then you could also, once you get there, find a job that where you could make at least the minimum amount for your household size, and then you would be eligible to get insurance on the exchange. Okay, and then you can purchase a non-ACA compliant plan. This is things like short-term health insurance, accident insurance, like a supplemental accidental policy. You can just have that just in case, say you get in an accident. It's not insurance, but you could get money it's paid out to you to help you to pay for your medical bills or your however you want to use the money, because the money is paid directly to you. Okay, critical illness insurance, discount plans, direct primary care plans, or healthcare sharing ministry plans. You can, they're not coverage per se, standalone coverage, but at least it'll give you something. So if something catastrophic were to happen, like an accident or you needing a surgery, and you have those type of plans that cover things like that, at least you will be able to have some, to claim and get some money in your pocket to help you to cover those expenses. Okay. Now you also can look into free clinics and federally funded community health centers. They provide a wide range of preventative and primary care services for people who are in the coverage gap. Okay, if you can find you can also a lot of community health centers offer care on a sliding fee scale, so they kind of go look at your income and they have a fee schedule based upon your income. Okay. You can also, and I really don't like to recommend this, but if there is something really going on, you can go to the emergency room. The emergency room cannot turn you away due to your inability to pay. But this is not, a long-term, a situation that you want to stay in long-term. You do want to be adamantly working towards, getting yourself out of the coverage gap, okay? But while you're in the coverage gap and you do need some type of medical care, you can always go to the emergency room. They will send you a bill that will be sent to collections if it is not paid. However, they cannot withhold future emergency stabilization treatment due to past due prior bills, okay? And so that's just a couple of things that you can do if you find yourself in the coverage gap, okay? And so, like I said, if you are in the states of Florida, Georgia, Mississippi, Tennessee, or Texas, and you're not quite sure if you are in the coverage gap or not, and you are needing insurance, you can book an insurance consultation with me. We can sit down, we can go over your needs, we can go over your income, we can figure out what's going on with you, and then we can, I can direct you which way you need to go in order to get your needs met, okay? All right, so I hope you found the information in this video useful and helpful. And if you did, please do give it a thumbs up, because that tells YouTube that this content was useful content, that you like this content, and so YouTube will show it to more people. Also, share it out with someone if you know someone who is in the coverage gap and they need some solutions on how to get their health needs paid for. You can definitely get this, send this to them so that they can get the information, the valuable information, okay? And so thank you for watching. Subscribe if you are liking this content and you would like to see more content like this put out on this channel, okay? And so that is all for this video. I will see you in the next video, and remember, together we can close the insurance coverage gap for African Americans. Have a good one.